Hi, I'm Tamara Ewan. I am a student in the Masters of Nursing Family Nurse Practitioner program at Indiana State University. I am performing an HEENT head, eyes, ears, nose, neck, throat exam. This is Giselle. She's agreed to be my patient during this exam. I do want everyone to know, my professors and Giselle as well, I do not have COVID. I don't have a sinus infection. I don't have strep throat. I don't have the flu. I, however, have a chronic cough. So I am wearing a mask for your comfort and safety. Just know that I don't have COVID. So, yes. And thank you for agreeing to do this for me. So, the first thing we're going to do for this exam is we're going to check your skin. And I've kind of been looking at the color of your face and your neck and the freckles and stuff, but I'm going to examine the skin on your arms, your hands, the palm of your hands, and your fingernails, okay? So we're going to just lift up your sleeve here, and we're going to note color, texture, temperature. It's not red, it's not warm, there's no vitiligo, there's no edema, there's no swelling, no psoriasis, no eczema. You do have freckles, but they're all very circular, no jagged edges, no nevi or anything like that. Hands are nice and smooth. We're going to check for skin turgor now. I'm going to kind of pinch your skin, and if you have good turgor, it should just fall right back down. So we'll do that. We'll hold it for about 2 seconds. 1, 2, and it just snaps right back down. So your turgor is great. No dehydration. We'll look at your nails. You have artificial fingernails, but that's okay. So we'll look at your cuticles, make sure they're nice and clean, no swelling, no redness, no hangnails. Look at the palm of your hand, no sores, no dry patches. Because you have artificial nails, I'm just going to make sure that you don't have any fungi under here, because that's pretty important. Okay, that looks great. No dry patches. Skin turgor is good. Capillary refill. Can't really do your fingernails, so I'm going to do just below your fingernails. 2 seconds. That's perfect. Love it. Now we'll do your other arm pretty quickly if that's okay. Looking for the same things again. No redness. Darker freckle there, but nice boundaries. No dry skin. Look at your palm of your hand. Check out these fingernails for fungi. No signs of fungi there. Your cuticles look great. No swelling, no redness. That looks good. Skin turgor is good bilaterally. Capillary refill is too. There's no clubbing of your fingers, so that is a good thing. So the next thing we are going to do is your scalp. I'm going to palpate your scalp. I'm going to look for nodules, lesions, masses, soft or firm, dry skin, and insects, lice, and other little things like that. Do you have any concerns right now? You do have some dry patches here.
Yes, so I do have a scalp condition. It's similar to eczema. I can't remember the actual name of it, but I am aware of the issue, and I do have a prescription shampoo that I use. I've just run out of it and have been unable to call in a refill.
Okay, I don't feel any masses or bumps. I don't see. I'm going to kind of go through because we do have a dry patch there, like you said, and you have a shampoo. No dry patches behind your ears or at your occipital. They're very common there. Your hair is thinning and breaking. You're aware of that? Are you aware of that?
Yes, I am aware of that.
Okay.
It's been going on for a little bit, but we're working on it.
No dry patches on your ears bilaterally. No insects, no nodules, no masses, nothing like that. So you're aware of the breakage and you have special shampoo for your dry patches there.
Yes.
Okay, that's good. All right, after your scalp, the next thing we're going to do is your face. We're going to look at beautiful face. We're going to look at symmetry. We're going to look at color. We're going to look at hair growth. I look at the corner of your eyes and where your ears are, make sure they're even, that your eyes aren't too close together or too far apart. Your nose is symmetrical, and your lips don't look dehydrated. So that is a good thing. I'm going to check your TMJ joint. I'm just going to touch right here. I want you to open and close your mouth. I'm going to look for clicking. I'm going to look for, okay, go ahead and open, close, open, close. Perfect. I look to make sure it doesn't get stuck and that it's good and it has nice movement there. Now we're going to look at your sinuses. You have temporal sinuses and maxillary sinuses. I'm just going to palpate them. You let me know if there's any tenderness or pain. I'm going to be looking for firmness and swelling. This is your temporal. Is that painful
No.
or tender? There's no swelling. There's no bumps. That's even. Now I'm going to look at your maxillary sinuses. Same way. Tender at all?
No, not at all.
No swelling. No bumps. No edema. Okay, so next up, I'm going to look at your temporal arteries. I'm going to palpate them, and then I'm going to listen to them, okay? I'm going to listen to them separately, okay? I don't want to, if you do it at the same time, you might not. Okay, I'll do it for about 15 seconds. Okay, that one is good. Okay, bilaterally, they feel great. Easy to palpate. Now we're going to take a listen. That's perfect. Okay, they sound great bilaterally and they're easy to palpate, so that's good. All right, now we're going to inspect your neck. There's kind of several steps to this, so if you can look to your right. Yeah, good job. I'm just looking for swelling, redness, bumps, nodules, dry skin, lesions. Now look to your left. I'm going to move this hair a little bit. No dry skin, no bumps, no lesions, no redness. Okay, now look to your right again. I'm going to look for jugular distension. I don't see any. I'm going to listen. I'll do the same as I did with your temporal. We'll listen separately. Okay, that sounds good. Okay, that sounds great bilaterally. Okay, now I'm going to look at your trachea. So if you can just tip up a little bit like this, I'm making sure it's midline, that there's no deviation to the right or left. I'm going to palpate, make sure it's midline, and look for the nodules, the masses. Let me know if there's any tenderness or pain. Okay, your one finger. Going to use one finger, and it's one finger indent above the SCM, so that's perfect. There's no there's no masses, no firmness. I'm going to check for your thyroid now. So if you can put your head up a little bit like this, I'm going to palpate here, and if you can swallow, okay, swallow one more time. Perfect. All right, we do that swallow test to make sure your thyroid isn't enlarged. Make sure there's no nodules and that it doesn't interfere with your swallowing. So that all looks great. And there's no redness or swelling anywhere on your neck. Okay, so we've done your neck. now we're going to look at your lymph nodes. If you have several lymph nodes, I'm going to let you know what they are when I palpate them. That means touch them. Please let me know if there's any tenderness or pain. Okay, and I will be looking for firmness, swelling, warmth, and movement. These are your preocular. Any pain there?
Nope.
Okay, postocular, just right behind your ears. You let me know if there's pain or tenderness. Occipital. Okay, now we'll do your tonsillar. Submandibular. Submental. You've got some superficial right here below your posterior cervical and posterior cervical. That looks good. Okay, so now we're going to check we've done your neck, we've done your lymph nodes. The next thing we are on is your eyes. So, I'm looking at your eyes. I told you they were beautiful before. They're evenly spaced. Your eyebrows are evenly spaced. There's no scaling. There doesn't look like there's any dry skin patches. There's no dry skin patches on your eyelids. Can you close your eyes? I'm going to look at your eyelash line there. You have beautiful eyelashes and they're nice and clean. There's no nodules at your conjunctivi. So now I'm going to look at your sclera and your conjunctives, and I'm going to just pull down a little bit here and make sure of the color. So if you can look up while I do that, that would be great, okay? All right, your sclera is nice and white. Conjunctivi nice and pink. No swelling, no redness, except the pink color it's supposed to be. No exudate. Okay. Got to kind of recover there. Did I pull a little too hard?
Oh, no,
Sorry.
no.
Okay, look up. Conjunctivi is clean, no exudate. Sclera is white. Conjunctivi is pink. Okay, now the next one is kind of uncomfortable, but I'm going to lift your eyelids like this.
Okay.
And I'm looking at the lacrimal gland and the swelling. I'll also, as I feel here, I'll also be feeling for tenderness and swelling, and you let me know if there is any. I'll do.
Okay, so just be a little more careful on the left side, as I did recently have eye surgery.
Okay, I will be careful then. Okay, there's no tenderness, sclera's white, no nodules, no masses. Okay, that looks great. What was your surgery for?
It was just to tighten up that muscle. It was a little loose, so it was causing the eyelid to droop.
Oh, they did a good job. There's no dripping. And in this eye, there's no tenderness. There's sclera's white, no redness, nothing like that. So now I'm going to check and make sure that your pupils constrict. I'll come in from the side. Now I do want to say my light is green and I don't know why. So I'm going to turn the lights down so that we get a good reaction here. I'm going to start from the side. If you can just look straight forward. Oh, nice. Good job. And I'm looking to make sure that as one eye constricts, the other eye constricts as well, which they both did. So I'm going to turn our lights back up. And I apologize, Giselle. When I checked your sinuses, did I check your forehead sinuses?
I don't know. I don't think so.
I'm going through my checklist in my head. So I'm just going to check your sinuses. I apologize for that, because you let me know if there's any tenderness, okay? These are your temporal sinuses. Any tenderness there?
No.
No swelling, no nodules, so you're good.
Cool.
But we have to make sure, we got to get it checked. So your eyes are good. The next thing we're going to check are your ears.
Okay.
Now we're going to check, of course, I palpate them. That means touch them at first. We're checking for masses, lesions, growths, things like that.
Okay.
So we'll check your left ear first as we palpate it. There's no bumps, there's no masses, there's no dry patches. Pinna is clean. They look good. So now I'm going to look inside your ears with my otoscope. I'm going to be looking for your tympanic membrane. We want it to be a pinkish gray color. So I'm always backwards a little bit. This is your left side, right?
Yes.
Yes. Okay, so I'm going to pull up and back. Then I'm going to put this in a little bit. Let me know if I'm looking for a cone of light, pinkish gray color on the tympanic membrane. No swelling, no growths, no nodules. I also don't want to see a silver lining anywhere because that could mean fluid in your ear. And that looks beautiful there. Good job, and your ears are nice and clean. Okay, I'm going to switch hands with my otoscope and come over to this side. Palpate, look for those masses, the lesions, the dry skin patches. So it's good that you don't have dry skin patches behind your ears. I know that happens a lot. Okay, your ears are nice and clean, no masses, no lesions, so I'm going to pull up and out and look in for that cone of light. I already switched hands with my otoscope. Got to find that cone. Oh, there we go. Okay, there's your nice pinkish gray. That's perfect. No growths, no lesions, no sores, no drainage, and no silver lining. You do not want a silver lining in your ears, but in most other things you do. Okay, so your ears look great. I'm going to do a whisper test now. So I'm going to stand behind you on your right side. I'm going to say 3 words. I'm going to whisper 3 words, and I'll have you repeat them.
Okay.
And then I'll stand behind your left side, say 3 words, and have you repeat them. Okay? I don't know if the camera can see me, but I am behind you. Ball, cat, sock.
Ball, cat, sock.
Okay, now I'm going to stand behind your other ear. Say whisper 3 different words. Light, foot, hair.
Light, foot, hair.
All right, so you passed the whisper test. Thank you for that. Your ears are good. So now we do your nose. As I look at your nose, I'm going to make sure it's straight, that it's symmetrical, not crooked. You've never had a broken nose, obviously. I look at your septum, make sure it's good. Now you have a nose piercing. Has that caused you any problems?
No, I mean, it's still fairly new, so it's still kind of in the healing process, but it's been fine otherwise.
Okay. Any problems smelling or anything like that?
No.
Okay, we're going to kind of palpate here. You know the drill on that. Now, is that tender at all?
No.
Okay, it's nice and symmetrical. I'm going to look in your nares. Look up a little bit. I'm going to look for redness, swelling, growths, nodules, drainage. Looks great. Other nair. Nice and pink and red. Pink. It's nice and pink. Okay, so that looks good. Now we're going to check your mouth. As I look at your lips, they are moist. They don't have any signs of dehydration. They're not cracked. There's no cold sores or any sores of any kind, so that looks good. They're symmetrical. As I check your mouth, I'm going to do a couple of steps to it. So the first thing I want you to do, I'm going to look at your teeth and kind of grit your teeth together. I'll look at your teeth. I'll pull your lips down to look at your gums a little bit. Then if you could just open your mouth and keep your tongue relaxed, I'll make sure it's midline. Then I'll have you stick your tongue out and say, ah. I'll check your pharynx for redness, swelling, growths, nodules. And then I'll check your buccal membranes and everything to make sure you're not dehydrated. I'll check your teeth while I'm in there. Then lastly, if you could take your tongue, tip of your tongue, put it up behind your teeth, your front teeth. I'll check your frenulum and everything there. Okay, so first let's check those teeth. Okay, they look great. Your gums look good. No signs of gum disease. If you can open up your mouth, leave your tongue relaxed. Your tongue is midline. It doesn't deviate. It looks moist, nice and red, no signs of yeast. If you can stick your tongue out and say, ah, your throat looks great, actually. No redness, no swelling, no growth. Your membranes, you can stop saying ah. Your membranes look nice and moist, no signs of dehydration, no missing teeth, and no, you have one filling. Are you crazy? Okay, now put your tongue up behind your teeth, your front teeth. Wonderful, nice and moist, nice clean teeth. That looks great. All right, Giselle, I appreciate your help with this. That concludes our exam for an HEENT, and I appreciate your help with this. Thank you very much.
Thank you.
Thank you. Have a good day.